Hello, and welcome to this recorded presentation of the Employee Benefits Program for Alliant Consulting, effective September 1st, 2022. My name is Bill Hammett. I'm proud to be your insurance broker. My contact information is on the screen. If you're having any escalated issues now or throughout the year, you're welcome to reach out to me. Happy to help, especially during open enrollment. If you have questions on which plan works best for you, or if you need help with anything involving the open enrollment process, you're welcome to reach out to me. Also available is Rhiannon and Anna. Rhiannon and Anna are great for finding doctors, understanding how certain benefits would be covered, and then throughout the year on claims issues or any issues that might pop up. You're welcome to reach out to any one of us. If it's a task that somebody else should do, we'd be happy to pass it along and help you in any way we can. So our agenda today, we'll talk about open enrollment, important dates to remember. We'll go over the benefit plans and how they work. We'll talk about some changes. The big changes, we're leaving United Healthcare and going with Anthem Blue Cross for just our medical plans. Our dental and vision will stay the same. In addition, we're adding two really nice new benefits to round out our benefits package. This is a recorded presentation, so questions and answers, you'll need to reach out to us on our Here to Help page, and we'd be happy to do that for you. So let's talk about dates and deadlines. Open enrollment goes from July 26th through Friday, August 5th. This is the time of the year where you can make changes, you can enroll, you can disenroll, you can move from the HMO to the PPO, or back and forth, whatever you want to do. Any changes that you do make would be effective September 1st, and we're asking that everybody fill out, complete their enrollment no later than Friday, August 5th. So here's our medical plans available. We have 6 from Anthem Blue Cross. There's 4 HMO and 2 PPO plans. Now the HMO plans, the 2 gold HMO plans and the 2 silver HMO plans, the benefits are exactly the same in the silver plan as well as in the gold plan to one another. The difference is the network of doctors you're choosing from. So you'll see in red, we have the select HMO plan. And at the bottom, you'll see select basically means sharp doctors. So if you're in San Diego and you're looking at one of these HMO plans, which most of you are, the select network gets you to the sharp doctors. For those of you that are currently enrolled on the United Healthcare HMO Harmony plan, you're going to want to go with the select network. That is going to be the one that is most similar to the Harmony network. And then the priority select network plans. This is mainly Scripps doctors. Now, there's more providers than just Sharp and Scripps, of course, but when it comes to the 2 major systems in San Diego, that's what you need to know. So for those of you on the Alliance HMO plan with United Healthcare, you're going to want to lean towards Priority Select. There's also the 2 PPO plans available. A little more info on the Select versus Priority Select. You'll see the Select HMO Medical Group, Sharp Steely, Sharp Community. That's going to be the bulk of the providers in that network, but also available is UC San Diego providers, Graybill Medical Group, Mercy Physicians. And then Priority Select, this is going to be, again, mainly Scripps providers. The Priority Select network is a little bit smaller than the Select network, but you'll see there's some similar providers. So Greater Tri-Cities, Mercy, Rady's Children's Health Network. Those are in both of the different networks. But if you are a Sharp, if you prefer Sharp doctors, you're going to want to go Select. If you prefer Scripps doctors, you're going to want to go Priority Select. So let's talk about the plans. Now, here you are seeing 2 columns of plans, but what you're really seeing is 4 different plans. Remember, we have 2 silver HMO and 2 gold HMO. I put them together like this because the silver select HMO plan and the silver priority select HMO plan are identical when it comes to benefits. The difference, of course, is the network of providers, like we just talked about. Same thing with the gold. The Anthem Gold Select HMO 35 has the exact same benefits as the Anthem Gold Priority Select HMO 35. So you're choosing silver or gold, and then within either one of those, you're going to be choosing the network that you prefer. So let's talk about benefits real quick. You'll see the benefits in red are the ones I really want to call your attention to, and you'll see the gold plan highlighted in those same areas. So let's start at the top. We're just going to work with these silver plans here real quick. We have a $2,500 deductible. A deductible is, generally speaking, what the insurance company asks you to pay 100% of before they start paying for any benefits. Now you'll notice there's a lot of these DED waived in here. See all this DED waived business going on here? Wherever you see DED waived, that means this $2,500 deductible does not come into play. You do not need to meet your $2,500 deductible before going to see a doctor, before getting lab work in an office, before getting a CAT scan, PET scan, MRI in a freestanding or office facility. Okay, so this is where the deductible does not apply. It applies generally to emergency room visits, hospital stays, surgeries, and stuff like that. $8,700, this is your out-of-pocket maximum. This is the most that you would ever pay in a calendar year, no matter what were to happen. All right, so if you were to have a catastrophic $1 million problem, then the most that you would ever pay is $8,700 for all covered services from in-network providers for the calendar year. Something to note is all of these deductibles and out-of-pocket maximums, they start over from zero on January 1st. So if we're getting towards the end of the year and you're thinking about having a surgery or something like that, I might suggest, if you can, certainly don't let it impact your health, but if you can, push that to the new year because then you will be using paying your expenses against a deductible that will be for the year, okay, rather than just for the last 4 months of the year. As I move down here, actually, before we do that, you'll see there's a $5,000 deductible for family and $17,400 for family here. And the term embedded. This term embedded is very important. Embedded means that no one person in the family unit has any more than their $2,500 deductible they need to meet, or their $8,700 out-of-pocket maximum, which includes a deductible. So this is not $11,300 or $11,200. This is $8,700 inclusive of the deductible. Now, if you are a family and you're all in the same, car accident, you all have major expenses, the most the family would pay is $5,000 and $17,400 out-of-pocket maximum. I'll give you a couple examples here in a second to kind of illustrate that. Moving down the list, we have our doctor visit benefits, $60 for a regular doctor, $110 for a specialist, deductible waived. So again, that means you get this benefit from day one, $1. You do not need to meet a deductible to get a $60 copay to see a doctor. Lab and X-ray, you're going to see with Blue Cross and increasingly with other insurance providers, including with United Healthcare, the one we're leaving. They have a different set of costs associated with getting services in an inpatient hospital setting or in a hospital setting and also outpatient hospital as well, versus a standalone facility. So if you were to go to a standalone facility or get lab work in an office, it's going to be $20 deductible waived. If it's in a freestanding facility, you'll pay $0 deductible waived. Now, if you're getting that X-ray in a hospital setting, whether you're inpatient or outpatient, you're going to pay your deductible first and then 45% of the cost. All right. So that's all for lab work. So that's blood work. Now, X-rays, here we're getting into X-rays down here, freestanding or in an office setting, $20 deductible waived. In an outpatient hospital setting, 45% after deductible. MRIs, CAT scans, PET scans, same thing, office or freestanding, $200 deductible waived. In an outpatient hospital setting, you're going to pay your deductible first and then the $350 copay. So right here, it can be kind of confusing, but this is where these health plans are kind of forcing us all to be better consumers of healthcare. So if you know you need blood work, you know you need an X-ray, you know you need an MRI, you know you need a CAT scan, I want you to remember to be a consumer in these events. I want you to call your member services number on the back of your ID card and say, hey, I remember that insurance guy said I can pay less if I go to a freestanding facility or I get these services not in an outpatient hospital setting. Tell me, please, where I can go that's in network, and they'll help you find a place that you can access these benefits without having to pay your deductible first. We've got here $60 copay for physical therapy, occupational therapy, speech therapy, deductible waived. Chiro, you get $35 copay for 20 visits, deductible waived. And then we've got our pharmacy benefits down here. So for an individual, it's a $200 brand name drug deductible. For a family, it's $400. Okay, no one person pays any more than their individual $200. And then once you get into your prescription drugs, this brand name drug deductible does not apply to our tier 1 generic formulary. All right, so you get a much lower copay there. But if you end up in tier 2, 3, or even 4 would be kind of your self-injectable drugs, those new cancer drugs, that hepatitis C drug that costs like $80,000 for a 6-week treatment. All of those levels, you would pay your brand name drug deductible first, and then you would get these copays. Now, another thing, you see level 1 and level 2. We'll talk about this in a moment as well. But Blue Cross, as with other insurance companies, Blue Shield's doing a lot of it now, they are dividing their pharmacy benefit into separate tiers, meaning the actual pharmacy that you get them from. Some are in their level 1, which is cheaper to them, so they pass along that savings is cheaper to you. And some are in their level 2, where it's going to be a little more expensive to you. Again, we need to be a consumer here. If you're a smart consumer, you can get your tier 1 generic drugs for $15, your tier 3 brand for $110 versus paying a little bit more. And we're going to talk about that in a second. All the way at the very bottom, we've got our $60 copay deductible waive for urgent care. All right. Let's talk about the big ticket items. Let's talk about emergency room, hospital stays, surgeries. Okay, you see it says 45% after deductible. What this means is after you've met your deductible, you would pay 45% of the cost. Anthem Blue Cross pays 55% of the cost until you hit your out-of-pocket max of $8,700, at which point you pay zero. All right. So let's talk about this in a real life example. So let's say I'm on this plan. It's me, my wife, 3 kids, and I get in a car accident. I rack up $1 million in claims, a week in the hospital, a month in the hospital, whatever it may be. I pay 100% of the cost for the first $2,500, and then I pay 45% of the cost. Blue Cross pays 55% of the cost until all of my expenses equal $8,700. Now, this $8,700 is inclusive of my $60 doctor visit, my $20 lab work. If I needed physical therapy at $60 a piece, so chiropractic at $35. Every dollar I spend is going towards this $8,700. So let's say I've spent $1,000 in copays throughout the year, and then I have this $1 million expense. I only need to spend $7,700 more dollars on the calendar year to get to that number. Okay, so it's a rolling number. It's not a per incident number. Same with the deductible. Let's say you had an MRI outpatient and it was $500. You would only have $2,000 more dollars to meet your deductible. The example I like to give is of car insurance versus health insurance. Car insurance, if you have a $1,000 deductible, you get in an accident in January, you pay a $1,000 deductible. You get in an accident again in July, another $1,000 deductible. Medical plans do not work that way. They are a cumulative annual deductible. So if you spend a few $100s before your deductible on some of these expenses that require that, let's say you go to the emergency room and it's $750, you will now apply that $750 towards your $2,500 deductible and only have $1,750 left. All right, so it's a rolling number. So back to my $1 million claim, let's say I have not paid anything towards my deductible out of pocket for the year. I pay 100% of the cost for the first $2,500. I then pay 45% until my 45% plus my $2,500 equals $8,700, at which Anthem Blue Cross pays the other $990,000. Okay. So that is how that would work. Now, if my whole family, now in that situation, I have now met my deductible and out of pocket in full for the year. So if I have another major event, if I need surgery, if I need an MRI, I will not pay anything for that. All of these dollar amounts go to zero once I've spent $8,700 on the year. Now, my wife and 3 kids, they have the other $2,500 deductible and the other $8,700 to get towards our maximum amount. So they can hit that in any combination of people. So just my wife can have all that expense, or my wife and kids could have a little bit of expenses and all get towards that deductible. So with all that in mind, we won't do the same exercise with the gold plans, but you can see 0 deductible. All right, that's very attractive. You're never going to be out of pocket 100% of the cost of anything. Out of pocket maximum, $6,750. That's much lower. Doctor visits, 35 and 70. Diagnostic lab and x-ray are lower. Imaging is lower. Everything is lower. No brand name drug deductible. The co-pays are lower. But especially the hospital, surgery, and emergency room benefits are a much lower dollar amount. You see, it's a $750 a day copay versus 45%. So in that scenario I had with that car accident, let's say I'm in the hospital for just 2 days. I would pay $750 for day 1 and $750 for day 2, a $1,500 total expense, and I go home on day 3, and that's that. Now, if I were to be in that hospital for a whole month, I would pay $750 for the first 4 days, and then after that, I do not pay any more expenses for basically the room and board. So that month in the hospital would cost me $3,000, and that's assuming there's no surgeries and MRIs and all that kind of stuff. If you have those kind of things, which I'm sure you would have some of these other copays. But again, it all rolls towards your max out of pocket of $6,750. So the way you really consider this and what you do about choosing a health plan is you would consider, what do I have coming up? What can I predict about my health plan year? Am I having a baby? Do I need knee surgery? Am I accident prone? Do I ride mountain bikes and go snowboarding? Do I end up in the emergency room 2 or 3 times a year? If that's the case and you got broken bones or you got surgeries coming up or you're gonna have a baby, I highly, highly recommend you spend a little bit more money and buy one of the gold plans, because yes, you will pay more out of your paycheck, but when you go to use the plan on these big ticket items, you will save thousands of dollars. Okay, so that's how you choose one from the other. Now, if you're someone who hasn't used your health plan in 3 years and you don't have anything on the docket for this year and you don't expect to use it in case something crazy happens, you're silver all day. That's as good of a plan as you really need. Here's our 2 PPO plans. Again, similar type of arrangement. The silver plan's got a deductible. The gold plan has no deductible. This gold PPO plan will be the most expensive plan available to you. But if you value choice and you don't want to have a lot of out-of-pocket expenses, this gold PPO plan is the way to go. You see the doctor visit copays are lower. What's interesting is the out-of-pocket maximums are very similar. The gold plan is a little bit lower, but not by a whole lot. Okay, brand name drug deductibles are higher, copays are higher, percentages for hospital stay, emergency room, or surgery are higher. Urgent care is lower than it is with silver PPO. So most of you guys are on the HMO plans, but for those of you that value choice, that want to see Scripps doctors and Sharp doctors, or maybe you have a big family with lots of different needs of providers, the PPO plans are a really great option for you. So remember we talked about that the level 1 and level 2 pharmacies with Blue Cross, with Anthem Blue Cross. You will have your level 1 pharmacies are CVS, Target, Walmart, Costco. So if you are enrolling in a medical plan, I suggest you kind of burn those retail pharmacies into your brain, because this is where you will save money. So Costco, CVS, Target, Walmart, that's where you want to go. When it comes to the level 2 pharmacies, there are many of them. It's kind of most of the rest of them. But Walgreens and Rite Aid, those are the ones that are going to be more expensive. So you want to stay away from Walgreens and Rite Aid. You can certainly go to Walgreens and Rite Aid, not a problem at all, but you're going to pay a little bit more. You'll see down here at the bottom how to find a pharmacy in the RX Choice Tiered Network, anthem.com/CA, choose order and manage prescriptions, and log on. So you're going to need to create a profile for yourself on the Anthem Blue Cross website so you can look into this. So Blue Cross is new to us, so let's talk a little bit about how we find a provider. We'll go to anthem.com/CA. In that top right-hand corner, you'll see the green button that says Find Care. You'll go ahead and find care. There's also this Register Now button. So when you get your ID card, I recommend you go in, register for your plan, get yourself logged in. and there's lots of great information online for you to find. So once you get into that, if you're looking for doctors, of course, as we're just enrolling, we don't have ID numbers. We can't log in and register your account because we don't have any ID numbers. So go to this guest. So log in as a guest. You're going to select the type of plan and network. That's a medical plan. The state, California. How do you get your health insurance? Through my employer. And then we've got our select plan or network. So just drop down here. Remember, priority select equals Scripps providers. Select equals Sharp providers. And then here's our PPO plan. So for any of you looking for PPO doctors, you would select that. Once you do that, you've selected your network. You're going to get into the next page. They'll ask you to enter your zip code. You can enter the name of a doctor or a facility. So if you want to find out about a facility, if they're in network, or if you're just simply trying to choose your primary care provider, which is something that is mandatory when you're enrolling, you can look up by Dr. Jones, Dr. Smith, whatever it is, or you can just search for different types of services. So if you're looking for, an outpatient, or you're looking for a standalone imaging facility or lab or blood work, you can do that there. And then of course, here's an urgent care button here. So emergency rooms are the most expensive ways to access care in America. So I highly encourage you to look at those urgent care benefits, urgent care options, and know where your nearest urgent care is so that you can access care at a copay rather than having to meet your deductible and all that. Here's a plug for the app, the smartphone app for Anthem Blue Cross. They call it Sydney. So lots of stuff on there, finding doctors, looking at claims, checking your benefits, downloading digital ID cards. So really, truly, the best single thing you can do to improve your health plan experience is downloading this app. So our dental plans, our dental and vision plans are staying the same as they were last year. We have our HMO dental plan. HMO dental plans are really great because they don't cost you very much out of your pocket every paycheck. But with that reduction in premium is also a limitation in number of providers. So HMO dental plans have a smaller network of providers that are in network. When you choose a dental HMO plan, you also need to choose a primary dentist. You must always see your primary care dentist. The number one mistake I see people make is they get an HMO dental plan and they go see some other dentist. The dentist just wants your money, so it doesn't say that you're out of network, but they just say the plan doesn't cover anything. Oh my gosh, you got to pay all this money. Make sure you're going to see your HMO dentist, okay? You can change these providers on medical, on dental. If you don't like your HMO doctor, you can change them anytime throughout the year. Our PPO dental plan is going to give you a lot more choice of provider. If you're someone that wants a lot of choices of providers, or maybe you just have a real fancy dentist that doesn't take HMO dental plans and you need to go with a PPO plan in order to get to this provider, you can do so there. The big thing to know about PPO dental plans is, yes, they cost more, but they have a lot more choice of providers. And also there is a calendar year maximum, and that is a $1,500 maximum benefit. All right, so if you are on this plan, once you've had a bunch of work done and United Healthcare has paid $1,500 out in a calendar year, they will pay no more, you pay everything else. So it's just the opposite of what we talked about with medical plans, where once you spend a certain amount, they pay everything else and you pay nothing. With dental, it's just the opposite. You pay everything else, they pay nothing. And that's at $1,500. Now, the sneaky little thing, the way to kind of stick it to the man a little bit, is if you have this dental plan, you enroll September 1st, maybe you were not on the dental plan before, maybe you were on the HMO plan, you enrolled on September 1st, you have from September 1 to December 31 to spend all $1,500 of benefits. And then again on January 1, you get another $1,500 to spend. So you could theoretically take this plan September 1st if you're newly enrolling. If you're already on the PPO plan, your $1,500 started on January 1st. But if you're new to the plan, you could have really $3,000 of benefits, $1,500 between September 1 and December 31, and then another $1,500 from January 1 to September 1 of 23, get the work done you need, and then cancel it next open enrollment. So nice little way to kind of get a lot of things done if you need to. Finding a dentist, you could go to myuhc.com. There's a little find a dentist button right on the home page. You would do that. With if you need to find one. Vision plans, it's the same vision plan providers we had last year. You have an annual comprehensive exam at $10. You get a $25 copay annually for your lenses. And for frames, there's a $130 allowance for retail frames. Okay, so that's our vision plan, exactly the same as we had last year. Finding a vision provider, same website, just to the right a little bit, there's a different button for providers, vision providers. Here's the plug to download the app again. We'll keep moving. Now let's talk about our enrollment portal. So our enrollment portal is online at it's the ease portal here. So you're all going to get an email that looks just like this. It says, welcome, we're alert, we are moving to Blue Cross. Just kind of let you know what's happening there. You'll hit the login button and you'll be taken to this screen here. You'll do your username and password. If this is your first time logging in, you'll be asked to create a password. If you forgot your password, you can click here. So that would be how you would do that. You would log in, you would land on this page, start enrollment. It can give you an idea what to expect. Here's the overview. Once I'm done recording this presentation, I will embed it right here for those of you that are just a glutton for punishment and want to watch this again. You can right here. You'll enroll all your information in here. Notice all the asterisks that you need to put in there. They need the county and the country, so a lot of extra information, hire date, all that stuff. Continue. Any of you who have dependents, I would recommend you enter them into this dependent category here. It does not mean you need to enroll them in the plan, but it does allow you to see what those costs would be. Continue. If you're on Medicare, you do that. Most of you are not. Next. So here we get to our benefits. So you can see on the right here, it's tallying up what my costs are on a per pay period basis, okay? And these numbers are after the company pays their portion, all right? So here's me. I've waived my wife because she's got her own plan through Blue Shield. I'm enrolling our kids. Here's my old plan with the Harmony Gold HMO plan. I was paying $325 a pay period. I've got all these different plans to choose from. There's all these different links that are included there. You see all the different plans. For those of you that are logging in here, you're gonna have to choose this plan. It's not gonna automatically be chosen for you. But this is, remember, select HMO equals the Harmony plan that we had before. And so you see there's a little bit for me. Now there's about a $19 pay period savings. So now you're seeing kind of why we made the move that we made. Also, the HMO networks have much more providers. There are a lot more providers than there were before with United Healthcare. So choosing this plan here, I can open up a benefit summary. I can look at all the different benefits. I can look in great detail as to how they cover certain things. I can click here to go to the Anthem Blue Cross provider page. Here's our, remember, we go to guests and we select one, boom, boom, boom. I can download the smartphone app, flyer. So all of these things are links that you need to select. And then lastly is a summary of benefits and coverage. This is a mandatory document that everybody must open. It is a requirement within the system that you open it, and it is because Obamacare says that your employer must show you this. So if you forget to open it with the plan you choose, you'll be prompted to go back and do that later on. Here is, I've elected to auto assign my provider because I don't want to make a choice right now. I can choose to change it at another time. Or if I really want to look up my doctor, I would click here to find the Anthem provider, follow along the prompts that we talked about before, and choose that provider. I'll leave everything as auto assign, continue. Here's our dental. I just want it for myself, nobody else. I just want the HMO plan. Again, links here to find more information on the plans. I've auto assigned, continue. Vision, waived my wife, enrolled my kids. All right, here's my different plans. Let's continue. Now we get into two more benefits, which are new, the life and the EAP benefit. So life, these are both paid for 100% by your employer. So it's going to be mandatory that you elect these benefits. There's no way to not elect these benefits. There's no choices. It will be pre-selected for you. And it's a benefit that your employer is offering to you, because we want to round out the benefit offering and want to make sure that we're continuing to grow our benefit offering to support you guys. So we'll go continue. Then we got our EAP plan, which again, this is free, so you want to just enroll everybody in this and see how it automatically enrolls the employee. An EAP is an employee assistance program. Now, an employee assistance program is a external entity. This is through Unum, where you can call and you can talk about things like stress, depression, anxiety, relationship issues, family or parenting problems. This 24/7 services. You can actually set up in-person meetings. You get 3 in-person meetings at no additional cost by a licensed professional counselor. So there's lots of really great stuff here. Even the work-life balance stuff, you can get help with elder care. This is a very popular one. Maybe your parents are getting a little older and you need help with that. Financial services, debt management. So a really, really good benefit that is in this new day and age where mental health is at the forefront of all of our minds. Really nice benefit for you to be thinking about, and it's available to you at no cost again. So then we have our beneficiaries. This is because we have our life insurance plan. Now there's primary and there's secondary. So I have my wife as my primary, but let's say we're both in the same car accident. We both die on the same time. My secondary beneficiary, this means that if your primary beneficiary is not around, the secondary beneficiary would get those benefits. You can add as many beneficiaries as you want, but it has to add up to 100%. Okay, so you'll see if I change this to 75%, it gives me a red here because it's like, nope, we need 100. So 100%, continue. Here's my summary. So this will give you a look at all the different plans you chose. If it's incorrect, if you didn't want to enroll your kids on this plan, you can hit the edit button and go back. You can print your summary here. So when you confirm all this is correct, you go to continue next. Sign forms. Now, if any of you have done DocuSign in the past, this is the same exact kind of process. You will type your signature and you will use your mouse to sign it like this. Next, next. And it just goes through, takes you through the every application that we have. And it just has you insert your signature. You're welcome to kind of look through all of this and see whatever it all says. Or you can just hit the finish signing button there. Tell us about your experience if you'd like. Otherwise, just hit this finish button at the top and you're all set. All right. So once you've done all that, then you are all set. So let's get back to our presentation. So what do you do now? You're going to be making your benefit elections in the ease portal. Be on the lookout for that email that I showed you. This is where you can make all your enrollments changes. Please do so by Friday, August 5th. If you skip this, if you elect not to do this, you will have to wait until next September to enroll. The exception would be for those of you that are maybe waiving because you're on your parents' coverage or you're on your spouse's coverage or you're on Medicaid or something like that. If you were to lose that other coverage in the middle of the year, that would be called a qualifying event and would allow you to enroll in the middle of the year. Okay, so if you're declining because you have other coverage and you lose that coverage, you are allowed to come back on the plan later in the year. All right, so that's it. If you got any questions, you need any answers, go ahead and reach out to us. It's an honor to be your broker. We're here to help in any way that you need from us. So please reach out to us if we can be of assistance. Have a great day. Thank you.